Ron, thanks for joining me. As a hospital leader, what are you seeing locally and across the nation as the most pressing workforce challenges that we are facing in healthcare today?
Thanks, Robin, and thank you for your leadership with AHA and AONL. It's just making a huge difference. Everywhere you go, this is the top of the list for every healthcare leader. It's the top three priorities are workforce, 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 and it's because of what's going on in all of our institutions. We're seeing challenges that have previously been cyclical in nature, and we've expected these and dealt with them. But this one's really different, and it's different for a number of reasons. I think that in many ways it's a perfect storm. We have an aging population that is increasing the demand on healthcare services. We have a aging workforce as well. We have supply side challenges with enrollment really not being where it needs to be to keep up with replacing those who are leaving the field. And then just because of what's gone on in the last 2 years, we have a workforce that is exhausted. They're still our healthcare heroes, but they're now exhausted heroes. And as a result, I think that many of them, certainly in our institution, and I think in most, have stayed with us longer than they might have. I certainly know of nurses and other healthcare professionals who might have retired 2 years ago, but they were not going to leave their coworkers or their communities, and now they're just saying, I just can't do it any longer. And so we're seeing the great resignation in this field as we are in so many others. So the immediate challenge for all of us is one of retention and supporting our staff in maybe ways that we haven't in the past to meet their needs. It's also, we talk a lot about nursing and physicians, but just to be mindful that it's really across the board, and it's not only the clinical healthcare professions as well. We see shortages in IT tech with healthcare experience, our support staff, because of the competition in other industries for support staff. We're having challenges there as well. And so in our organization, we've seen an increase in turnover across the board and in nursing as well. And as I talk to other colleagues, I'm hearing increases in turnover of 30, 50, 60% increases from 8 to 12 or 10 to 20%. And I know for us, and as I've talked to others, there's a even higher level among those who have joined the organization in the last couple of years. Maybe this isn't for me, and so that's the big factor is being able to staff our facilities to take care of our communities. But it's also because of the impact of COVID. It's finding ways to support them so that they will stay in hospital and health systems taking care of our community. They have, we've asked more of our staff, and society has asked more of our staff than really should be expected of healthcare professionals or anyone. When you think about the last 2 years, they've dealt with PPE challenges and shortages. They've dealt with opening and closing isolation units from 1 to 3 to 5 to 6, and then back down and then back up again. They've dealt with setting up in our labs, setting up testing platforms where tests didn't exist before. Drive-through vaccine clinics. I mean, you think about all that's been done in the last 2 years, and particularly coming out of spring of 20. And it's not only the magnitude of the change, it's the pace of change. They've been called off because we've had to close down operating rooms. They've been called back because we reopened them. Visitor policies. And then at a very emotional level, many who have worked with our COVID patients have seen more death than they ever had in their careers or might ever have seen in their entire careers. So there's an emotional impact. There's a physical impact for some who might have lost income in their family, for others who lost their positions. There's a financial impact. And what I find inspiring is the fact that through all of that, through taking off and changing clothes in their garage when they went home, from being there every single day, our staff are amazing. They set that aside and still place the patient at the very front of their priorities. And so there's just a real call for us to support them now, and we have been supporting them in many ways. I know that we've all tried to do that, but because of this, I think, and that the elevated turnover and the fact that there aren't signs that it's going to get better unless we take some actions on this. Our very biggest challenge and our first priority is retention and being able to staff our facilities.
So Ron, first of all, that was an outstanding overview. And in my role as Chief Nursing Officer for the American Hospital Association, in my conversations daily with clinicians all over the country, that is exactly what I'm hearing. And I think you alluded to it, but the duration of this too is one of those things that has just so impacted both our clinicians and the rest of our healthcare workforce. But as you and I both know, we are doing a lot about the future. And I share your optimism. So please tell our listeners about the task force and how our group is prioritizing the challenges and helping to lead the development of resources.
First of all, I want to thank Rick Pollock and the whole staff team at AHA, and Robin, obviously your leadership role there as well, for recognizing very quickly the importance of this issue. And then thanks to the board of the American Hospital Association for appointing a workforce task force to really address this in a very broad and meaningful way that we hope is going to be very helpful to the industry now and for the long term as well. So we have a group of 15 members on our workforce task force that are meeting monthly. We started meeting in February, and we'll meet every month throughout the year. It's comprised of it's multidisciplinary nature. We have nursing leaders and physician leaders and executive leaders, most of whom are on the AHA board, but we have representation from other organizations there as well, specifically AONL. And so it's a big task, and I think the early work is figuring out how to tackle all of this. And so our focus really has been on trying to achieve an objective. We drafted a charter at our first meeting, and really our goal is to provide recommendations and tools, data, best practices, analyze whether there are regulatory or legislative changes that are required to meet our needs going forward, and to provide that information that is useful to the field, whether you're leading a system or a critical access hospital or public or private, nonprofit or investor-owned. We hope that this will be useful to the field. We've developed a framework to do that. We've organized ourselves in a way that has tried to identify those issues that are in the now. And so I think I've talked about those challenges. It's really right now. It's staffing and the immediate workforce challenges, and how can we support, what are the best practices and tools that enable us to support our staff so that they stay with us and we can retain these highly skilled and dedicated people. We have another category of tasks that we're working on that we call near, which will take a little bit longer to see the results. And then a third category for far, and that has more to do with pipeline and supply side coordination with and collaboration with academic institutions that graduate our healthcare professionals, and possibly care model changes as well. It'll just take really longer to see what works in that area. But I think an important point is that we're not looking at this as we're going to address the now this year and the near next year and the far in year 3. We really need to start down all of these tracks now and just recognize that there are things that we hope are going to be very helpful in 2022, and there are things that are just going to take longer before we see the outcome of that. We are very clear that there's a lot of work going on in this space. And so we are recognizing, acknowledging, collaborating. AONL is doing a lot of work on this to really understand and assess and make recommendations for nursing staff in our country. We expect that by the end of this year, we will have 1 million nurses that we need to replace just due to retirement alone. And so really grateful for the work at AONL and other organizations that we're collaborating with, particularly all the state associations. I believe that there are 26 state associations, and that number may be higher now, that have coordinated efforts around addressing this issue. So our plan is to, as soon as we have things that we think will be useful, we'll get it out to the field. This is not going to be a final report that comes out at a point in time, much along the lines of the work that was done under the leadership of Dr. Mindy Estes in the Pathways to Recovery work in 2020 around COVID. We think that there are things that will come out of this that the field can make use of as it goes along. I'll just mention, Robin, that the work products range from simply creating an inventory of existing resources. There are a lot of resources that AHA and others have right now that can be used and can be useful to our health systems. We also want to share best practices around the country on strategies for retention, addressing, I didn't mention earlier, but the issues around workplace violence is very significant. I know in our organization, we've gone from about 100 reports of workplace violence 4 years ago to nearly 500 last year. And so it's a really important issue for us to do everything that we can to address. No one should feel unsafe working in our hospitals for our community. And so I think there are a lot of things that we can do there, and we want to find those best practices and get it out. Creating staffing opportunities, potential new care models. And again, some of this will require some structural changes and legislative reforms. We look forward to our future meetings and being of help to all who are looking for that. Just being at AHA annual meeting and talking to colleagues. Previously, when someone that you might not have seen for a while would say, "How are you?" You thought the question meant, "How many COVID patients do you have?" Now it means, "How are you doing on staffing?" Now, and so it is pervasive throughout the field.
I agree with you, Ron. Particularly the way you broke down what the task force is attempting to do around format and structure. So we know, and we've heard it so many times, we can't boil the ocean. What are those priority foundational elements? What do we need to do right away? What do we need to do for the near and the far future, but needs to start today? And who needs to do it? Because we know that there are many external partners, as you said, that we are collaborating with. So we don't want to reinvent the wheel. You mentioned AONL a little bit. I'll just mention that the American Organization for Nursing Leadership has a complementary committee that we are working specifically with those 4 members of who participate on the AHA task force. They lead our AONL initiative, doing deep dives into retention and staffing for nursing and nursing leaders. We know how critically important, particularly the front line, the nurse manager is to the, well-oiled machinery of a hospital or a healthcare system, and we're worried about them because they have really borne the brunt of, being on the front line with their teams, as well as then getting directives from leadership, and they are worried about staffing their areas 24/7. We also know that there's best practices. We've had a recent in-person conference that had we saw many examples of innovative care models. We're studying those to determine what really, which ones have legs for the future. We know, as you mentioned, we'll be 1 million nurses short by the end of the year. So necessarily, our way of looking at delivery of care needs to be modified. We want to maintain quality and safety, be sensitive to the issues around workplace violence, but we also know we have technology that can help enable, and also members of the care team. So looking at all those. So lots going on in tandem with AHA and AONL. And, I guess, what gives you most hope, Ron? When you think about the future as it relates to healthcare, what are you hopeful and excited about?
I think there's a lot of things to be hopeful and excited about. And I'll just mention that I had a professor many years ago in graduate school who started most of his lectures with the comment, "These are very tumultuous times." And so that was many years ago, and it's just always struck me that tumultuous times come and go. They're a bit in the eye of the beholder, but we get through it and we figure it out. And so I think for me, I would just mention that the innovation of our systems, with a lot of support, with a lot of creative minds at our associations that we work closely with, the innovation was never more evident than it was during this pandemic. We were in a week figuring out how to print 3D face shields. And so to me, just this is an issue that is going to require that kind of thinking, and we're up to it. I think that the innovation that we have with great minds around the table in our hospitals, and in this case, through this task force and the work at AONL, really confident that we will be able to come up with solutions. One of the problems that I'll turn into a hope and a confidence has to do with the academic institutions and their challenges. So we know that there are limits on enrollment because of structural issues, funding issues that we have at our healthcare professional colleges and universities. What we don't have is a shortage of young people interested in healthcare. And so you round and you talk to the people who are in our institutions, and these are people who are driven by a core value of excellence and integrity and compassion. And there are a lot of young people out there on waiting lists to get into academic programs to come to work in our organizations. And so that's probably the part that gives me the most hope. This is incredibly hard work, and it's incredible, meaningful, and joyful work for those who decide to go down this path. So it's going to be hard work for us. I'm very hopeful. There are other challenges that we haven't discussed that have to do with the financial implications for health systems now. There's going to be a lot of upward pressure on compensation and benefits because of the imbalance that we have. We have issues on the cost of contract labor. But I do believe that because of our commitment to doing the best for our communities, that we will come through this.
And I would just add to your comments that it's incredibly important work, perhaps the most important work of our entire career. So thank you for joining me, Ron, and thanks for your leadership of AHA's Workforce Task Force. It's just incredible work, and I'm really excited about this year's work and beyond.
Great to work with you, Robin. Really appreciate it.
You as well, Ron. Thank you.